Welcome to Adewale Adeniji, coach and behavioral therapist, AACBT. In our video offerings, we teach how we can become better in a holistic way and positively affect those we relate with. Our vision is to provide guidance and offer systems and tools that will ensure leverage professionally, economically, and socially. Lasting change begins first within, before situations become better. And this is what we promise, because we believe everyone deserves an opportunity to excel. Our mission is to help rethink, ideate, and acquire leverage. Please go through this platform and watch our video offerings, and don't forget to like them and subscribe. Thank you. Enjoy our broadcast.
Hello there. Today, 10th October, is World Mental Health Day. It is a day observed yearly with the overall objective of raising awareness of mental health issues around the world and mobilizing efforts in support of mental health. The day provides an opportunity for all stakeholders working on mental health issues to talk about their work and what more needs to be done to make mental health care a reality for people the world over. This year's observance is more pertinent because the world is in the throes of the COVID-19 pandemic, with its clear effects on the mental health of all. What with the restrictions, the isolations, etc. So, this year, more than ever before, mental health is not an issue that can be swept under the carpet. The months have brought many challenges. For healthcare workers, providing care in difficult, harrowing circumstances, going to work fearful of bringing COVID-19 home with them. For students, adapting to taking classes from home with little contact with teachers and friends, and anxious about their futures. For workers whose livelihoods are threatened or have been compromised. For vast number of people caught in poverty or in fragile humanitarian settings with extremely limited protection from COVID-19. And for people with mental health conditions, many experiencing even greater social isolation than before. And this is to say nothing of managing the grief of losing a loved one, sometimes without being able to say goodbye to them. The economic consequences of the pandemic are already being felt in many nations of the world as companies let staff go in an effort to save their businesses. Or indeed, some businesses have shut down, completely denying their workers of livelihood. Given past experience of emergencies, it is expected that the need for mental health and psychosocial support will substantially increase in the coming months and years as the world continues to battle with this pandemic. Investment in mental health programs at the national and international levels, which have already suffered from years of chronic underfunding, is now more important than it has ever been. This is why the goal for this year's World Mental Health Day campaign is increased investment in mental health. Mental health is one of the most neglected areas of public health. Close to 1 billion people are reportedly living with mental disorders. 3 million people die every year from the harmful use of alcohol, and 1 person dies in every 40 seconds by suicide. And now, billions of people around the world have been affected by the COVID-19 pandemic, which is having a further impact on people's mental health. Yet, relatively few people around the world have access to quality mental health services. In low and middle income countries, more than 75% of people with mental, neurological, and substance use disorders receive no treatment for their condition at all. Furthermore, stigma, discrimination, punitive legislation, where there is legislation at all, and human rights abuses are still widespread. The limited access to quality, affordable mental health care in the world before the pandemic, and particularly in humanitarian emergencies and conflict settings, has been further diminished due to COVID-19 as the pandemic has disrupted health services the world over. Primary causes have been infection and the risk of infection in long-stay facilities such as care homes and psychiatric institutions, barriers to meeting people face-to-face, mental health staff being infected with the virus, and the closing of mental health facilities to convert them into care facilities for people with COVID-19. That is why for this year's World Mental Health Day, WHO, together with partner organizations, United for Global Mental Health and the World Federation for Mental Health, is calling for massive scale-up in investment in mental health to encourage public action around the world. A World Mental Health Day campaign, Move for Mental Health, Let's Invest, already kicked off in September of this year, 2020. My dear listeners, World Mental Health Day is an opportunity for our world to come together and begin redressing the historic neglect of mental health. My dear listener, the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, says that World Mental Health Day is an opportunity for the world to come together and begin redressing the historic neglect of mental health. He further said that we are already seeing the consequences of COVID-19 pandemic on people's mental well-being, and this is just the beginning. Unless we make serious commitment to scale up investment in mental health right now, the health, social, and economic consequences will be far-reaching. I personally hope it will not come to this. I know for a fact that during the past few months, the World Health Organization has issued, in collaboration with partners, guidance and advice on mental health for health workers and other frontline workers, managers of health facilities, and people of all ages whose lives have changed considerably as a result of the pandemic. With the disruption in health services, countries are finding innovative ways to provide mental health care, and initiatives to strengthen psychosocial support have sprung up. Yet, because of the scale of the problem, the vast majority of mental health needs remain unaddressed. The response is hampered by chronic underinvestment in mental health promotion, prevention, and care for many years before the pandemic. It is a data-proven fact that countries spend on average only 2% of their health budgets on mental health. Think about that. Just 2%. Despite some increases in recent years, international development assistance for mental health has never exceeded 1% of all developmental assistance for health. This is despite the fact that for every $1 invested in scaled up treatment for common mental disorders such as depression and anxiety, there is a return of $5 in improved health and productivity. Therefore, this World Health Day campaign will offer opportunities, primarily online given the continuing pandemic, for all of us to do something life-affirming as individuals, to take concrete action in support of our own mental health, and to support friends and family who are struggling, as employers to take steps towards putting in place employee wellness programs, as government to commit to establishing or scaling up mental health services, and as people adept in the use and deployment of the social media, to use our platforms to explain what more can and must be done to make mental health care a reality for everyone. This is, for example, what I am doing right now, and you also can do the same. In my country, Nigeria, the state of mental health care is very poor indeed. So poor that Nigeria's extant mental health legislation is sadly stuck in the pre-colonial era. And just a few days ago, Nigeria marked 60 years of independence. This pre-colonial era legislation has its roots in the UK Lunacy Ordinance of 1916, which assumed the status of Nigerian law in 1958. Till date, the Nigerian legislature have not deemed it fit to pass a mental health legislation despite several attempts in the past. So, there really is no legislative framework that takes cognizance of the mental well-being of the Nigerian populace, meaning that the colonial ordinance, which has no such provision, is still the regulatory framework for mental health issues in Nigeria. And I can say the same for several African countries. As I round up this broadcast, my dear listener, I should like to discuss with you what we should do to care for ourselves and others, whether we accept it or not, that mental health issues are on the rise. First thing I will counsel all of us to do is to be aware of our feelings per time. My dear listener, it is okay for us not to feel good, physically or emotionally. It is okay. It is not wrong to feel down. It comes with the season. So, if you feel at odds from your normal self, I encourage you to seek help. Seek help from the available medical facility closest to you, or talk to a therapist, people like me. The second thing I will counsel is try to get proper sleep. You cannot function at an optimal level psychologically when your brain remains active for too long. You need to find pockets of space in your day to take a nap, and you need to ensure that at night or when you do have your long sleep, you sleep indeed. Third, watch what you eat. I am sure you will have heard that we are what we eat. For example, too much sugar and caffeine can affect your mood. Let us watch what we eat. Fourth, get outdoors every day. Move among other people. Walk in nature. Take walks. Go about. Walk among other people. The fifth counsel, which is aligned with the last counsel, is keep moving. Take a walk. Exercise in whatever form you are comfortable with. Do not sit for too long in a sedentary position. Number 6, and this would be challenging, believe me, limit your screen time. watching television, being on your smart gadgets. As therapists are increasingly finding a connection between too much technology and depression and anxiety. My dear friend, it is my wish that we all live in good health, physically and mentally. Therefore, on the auspicious occasion of World Mental Health Day, I wish you all the very best robust health, physically and mentally. Take good care of yourself. Bye for now.